A 48-year-old woman is experiencing abdominal pain after eating, specifically in the right upper quadrant, for 1 month. The pain is worse after fatty meals, and an ultrasound shows mobile echogenic foci in the gallbladder lumen. What condition is most likely present in her gallbladder? Now, this patient's symptoms of abdominal pain after eating, specifically with fatty meals and pain in the right upper quadrant, is going to be consistent with gallstones. Now, when we have extra cholesterol in our body, we can get rid of it in two ways. One is going to be to put it in bile. So here we can put this cholesterol that we have excessively in the body into bile. The next is we can convert this cholesterol into bile acids in the liver. Now, this can happen through a series of reactions, and the first enzyme that we're going to use in this series of reactions is going to be cholesterol 7 alpha dehydroxylase, and this is going to be the rate limiting enzyme. So, this is what is most high yield to know. Now, bile acids can then be conjugated to form bile salts, and this can be then secreted into the bile canuculi. Now, bile acids are important because once they're put in bile, they're going to try to make cholesterol soluble along with phospholipids like phosphatidylcholine, which is also going to be found in bile. Now, cholesterol is going to be insoluble in liquids, and because bile is a liquid, we need substances like bile acids and phospholipids like phosphatidylcholine to make cholesterol soluble in bile. Now, if we have too much cholesterol, then bile acids and phosphatidylcholine will not be able to keep up. And so this extra cholesterol can then precipitate out of the solution to make cholesterol stones. So in this patient, she probably has high levels of cholesterol as well as low levels of bile acids and phosphatidylcholine because she's presenting with gallstones, so she most likely has these conditions in her body. Now, what is important to know is that most of the gallstones that patients will present with are going to be cholesterol stones. So 80% is going to be cholesterol stones, and 20% of the gallstones are going to be bilirubin stones. And bilirubin is, remember, going to be produced from the breakdown of red blood cells. So when red blood cells are broken down, we're going to get unconjugated bilirubin. And this is important because unconjugated bilirubin is going to be what is going to be precipitating out in order to make stones. So unconjugated bilirubin is insoluble, and when it is in bile, it can form a complex, a insoluble complex with calcium, and can precipitate out of bile along with calcium in order to form stones. Now we're going to call this pigmented stones because bilirubin is a pigment, and because unconjugated bilirubin is going to precipitate out with calcium, it is going to be radio opaque on radio imaging. Now, this was a slide where I talked about how when we break down red blood cells, we're going to get unconjugated bilirubin, and unconjugated bilirubin is going to be insoluble until it becomes conjugated in the liver with the help of the enzyme UTP glucuronidase transferase. Now, here's an overview of gallstone formation. So this is basically going to be caused by components of bile precipitating out, so either bilirubin or cholesterol precipitating out. So cholesterol stones are going to be radiolucent because they're going to have low calcium, whereas bilirubin stones are going to be radiopaque because they're going to draw calcium with it when they precipitate out of the solution. And bilirubin stones are going to be black stones, as you can see from this picture, and cholesterol stones are going to be these yellow stones. Now, our patient in the question was a female, and females are going to be at a higher risk of developing cholesterol stones because estrogen is going to upregulate HMG-CoA reductase, which is going to be the rate-limiting enzyme in cholesterol synthesis. So they're going to have a increase in cholesterol levels in the body as a result. So this is going to make it more likely to form cholesterol stones for females because they're going to have this cholesterol to bile ratio that is going to be high in cholesterol. And so, if you have a high cholesterol to bile acid ratio, then cholesterol can precipitate out of the solution to cause cholesterol stones. So anything that increases cholesterol or decreases bile acids can cause cholesterol stones. So this is important and comes into play with Crohn's disease. Remember, with Crohn's disease, we have inflammation in the terminal ileum, and terminal ileum is going to be the site where we're going to be reabsorbing bile acids. So if we're not able to reabsorb bile acids, then this is going to cause low levels of bile acids in the body. And so this is also going to increase the cholesterol to bile acid ratio in the body. And so now cholesterol can then precipitate out of the solution to cause stones. And remember that with bilirubin stones, what is going to precipitate out is going to be the unconjugated bilirubin. And it is going to precipitate out with calcium, as unconjugated bilirubin can form insoluble complexes with calcium in the bile. Now, anything that can cause extravascular hemolysis or biliary infection can increase the likelihood of patients developing bilirubin stones because this is going to increase the breakdown of red blood cells. And remember, when we increase the breakdown of red blood cells, we're going to get higher levels of unconjugated bilirubin. And then unconjugated bilirubin can form an insoluble complex with calcium to precipitate out of the solution to form stones. So the correct answer was going to be this answer choice. We're going to have a increase in cholesterol levels, decrease in bile acids, and decrease in phospholipids like phosphatidylcholine in this patient who has gallstones.